After 2 years, we are back here at FIAR with interviews regarding the insurance market in Romania, and not only in Romania, international level. Today we have a special guest here, Mr. Laurent POCHAT-COTTILLOUX, CEO, AXA Life and Health Reinsurance Solutions. Welcome to Romania, welcome to FIAR.
Thank you. It's very nice to be here.
Yeah, it's very nice to have you here in flesh and bones, as they say, not only online, in online conferences. In the post-corona world, what is the European health market system situation and how the insurance companies should react to it?
Well, the COVID pandemic really was the biggest global health crisis we've had for the last 100 years. It's been a massive shock to all the healthcare systems around the world and in Eastern Europe. And consumers have realized how fragile these public healthcare systems are and how important it is to think about added protection, added health insurance to make sure that they can access the best care possible at the time of their choice.
And how did the system adjust to the new situation?
There has been a lot of digitalization. Doctors have got used to seeing patients on a screen, like we all had to do in our lives and working lives. The Zoom doctor is with us, and that was not really going to happen for at least maybe 5 to 10 years. And the pandemic has really accelerated this digitalization of healthcare, which is good, because we don't have enough doctors. So it makes doctors more accessible, and it's good for health insurance companies as well, because your teleconsultations are cheaper than in-person consultations.
So this digitalization was one aspect, the
Yes.
adjustment to the new reality. And for the health insurance companies, what else did they have to do to fulfill the new needs of the client?
Well, we had to focus a bit more on mental health. It has been a tough time for everyone these last 2 years, and whether you're a housewife or a professional or a student who couldn't go to university or someone who had to work from home all of a sudden, or a lot of adjustments had to be made, and with insurers everywhere, I've received a lot more requests for mental health coverage, and that's something that we've been including in the product, with higher benefit, more coverage, more services around mental health support.
Could we say that insurers were a support during all these hard times?
They've been trying.
They've been trying.
Yes, not always successfully.
Surely you would agree that there is a huge displacement of population in Europe right
Yes.
now. People are moving from country to country because of the work and because of the
Yes.
war. How is AXA preparing for this phenomenon, and what are AXA's plans for Central and Eastern Europe?
Okay, so two different parts of the questions. On the first part, mobility. People, because of the changing nature of work and the remote working that we're now doing, there's actually a little bit less movement. You can work from where you are, when previously you had to take a plane or travel around. It does change a little bit the risk profile for health insurers. You're thinking about maybe less travel risks and more occupational risks at home, in the home, like, I don't know, accidents in the kitchen, or repeated injuries, train injuries, when you're sitting in your armchair instead of sitting in a good office chair. Your back pain, we're seeing more claims for back pain. So lots of different ways in which the risk has been adjusting because of the changing nature of work. The war is creating obviously massive massive changes. There's a lot of people on the move. All these people will also require some kind of healthcare, and that's a really tricky challenge for health insurers. How do you cover migrants, whether they are war refugees or economic refugees, when they are not yet completely inserted in the formal economy? It's something that initially would be tackled by governments and charitable organizations, but over time we expect to be able to see new products emerge for these new classes of customers. And they need help, they need a lot of help. So maybe cheaper products, products in their own language. So maybe, why not have one day a Romanian insurer or Polish insurer with a Ukrainian-speaking helpline? They will look at these millions of customers as a new segment.
In Romania, we've had help from private medical centers who
Yes.
offer
Free treatment.
treatment, yes, for Ukrainians. And it was the case in Romania because we were the first to receive them, Poland,
Yes.
Romania. But maybe this would be the case for other countries as well, because some of the Ukrainians went from Romania to other countries
Yes.
in Europe.
I hear that the number of Ukrainians in Romania now is a bit lower,
Yes.
going around. But initially, it's a big challenge to help all of these people, and over time, as they settle down, and not all of them will come back this war is probably going to last a long time, unfortunately. There is going to be the need for specific solutions for those. It's not just Ukrainians, it could be Syrians, it could be Afghans, and economic migrants too. People are more mobile around the world than they were 30 years ago. And after the pandemic, these will restart. And health insurance products that offer regional coverage. Maybe you buy your policy in Romania, but you can access treatment across all of Europe, for example. These are the kinds of products that would be very interesting for professionals who have to move around a lot.
So basically, new products will be necessary
They
soon.
will emerge, yes, exactly.
All over
Yes.
Europe. What is the role of the brokers in the changing medical environment in the Central and Eastern Europe?
Well, as I was saying earlier in the conference, the brokers are essential for the sale of health insurance. Why? Because health insurance is super complicated. It's a lot more complicated than motor, home insurance, even life insurance. The policy wording is like 30 pages. There's a lot of explaining to do, a lot of difficulties or complexities when you are accepting a new customer, because you have to go through their entire medical history, and what should you declare, what doesn't matter, what matters. All of this requires a face-to-face conversation with someone who is very knowledgeable with the product, and can help you decide which product is the right one for you. We need brokers for health insurance. I'm convinced of that. Or agents, brokers, someone who can explain. And as health insurance grows larger and larger, I know today in Romania it's a small market, but it's growing. From 2019 to 2020, the growth rate of health insurance in Romania was plus 18%, according to your own report.
Yeah, thank you. We're glad we're useful.
So it's growing very fast, and it's because people know they need it. They know their public health system is not going to be able to meet all their needs, and brokers have got this major role in helping society get better coverage.
We've heard that some brokers find it difficult to switch from motor and property insurance
Yes.
that they are used to sell to health insurance, which is
For
not
sure.
an easy product. You need to understand it, you need to know how to talk with the client and to understand his needs maybe better than he does. How do you advise the brokers to overcome this obstacle?
Well, you need to be ready to invest a lot of time, and there's no shortcut. You can't just cut corners.
You got the MTPL, take the health insurance too, yeah?
It's not going to work. But that it's also each product provider will have different ways to train and support their brokers. Okay, so we AXA, we've chosen to work with MediHelp International in the mid-market. It's quite it's a very nice product. They have something called the MediHelp Academy. And if you go to Google and the MediHelp Academy, there's a bunch of online courses, like you would, explain to you exactly what is health insurance for, what is in the product, what's covered, what's not covered, and they accredit their distributors. You have to pass the courses in order to sell the product. This is excellent. This is the kind of things that you can do from home. You can, if you want to distribute a product from that particular provider, it's you put in the time and you will do it.
It's worth it.
And it's worth it
because it's growing.
It's growing, it's good commission, it's profitable for the insurance company. Yeah, it's growing 10%, 15% a year, easily. it's worth the effort. It's not easy, but it's worth it.
So they should think as business people and just see this training as investment in what they can earn from health insurance.
And I would say it's probably not, you shouldn't try to get everyone in their sales team to go from MTPL to health. Just select one or two people who are maybe those who tend to sell maybe higher value motor insurance or who have more wealthy customers, and say, okay, you are going to have another target, health, or just make them dedicated to health. And over time, they can show and be the champions for the product to the rest of the team.
Because you've mentioned MediHelp, AXA chose MediHelp International as their main partner in Central and Eastern Europe, and in Romania as well, of course. What were the strategic reasons behind it?
Well, look, we are a life and health reinsurance company with a worldwide footprint. We're always on the lookout for new partners. MediHelp to us looked like an ideal company with a great innovative product. I especially like their medical cash card, so you can go into a clinic or a doctor and pay with a MediHelp card, and you don't have to fill in a claim form. With great customer service, great customer centricity, they put the customer at the heart of everything they do. Good underwriting, discipline, stable prices. It's a great little company with a good product, and we think they have a good potential for growth. So, all good reasons for us to partner with MediHelp.
Okay, well, I would end this with a message from our behalf, since you're here for the first time in Romania and at FIAR. Part of the conference dedicated to brokers is almost over. We still have the health insurance conference. Yes. So what would be your message for those attending FIAR this year? And not only those who are following us.
To anyone following this particular industry, think about diversifying. Think about the world beyond motor insurance. There's property, there's more different kinds of liability insurance, and health insurance is one of those products that will grow and grow and grow, with which you can really engage your customers around, because it's a product that they use, not a product that just sits in a drawer and never gets used. So I'm a fan. I've been doing health insurance for 25 years. I love it, and it's a great product to be involved in.
Thank you very much for this advice. We end with this good advice, and thank you for everything you've told us so far. We'll be looking forward to have you again, not only at FIAR, other events as well here in Romania, and why not in other countries where we have events. Thank you very much.
Thank you.